This week, we picked up a camper. What is it? What is it called?
I don't know. I don't know what these are called. It's like a tent for your car.
It's a tent that you put on the roof of your car.
And it goes pop.
Boom, and then you can sleep in it.
And there's a little ladder.
So the idea is that we are going to go camping.
The idea.
The idea is that me and you and your dog and the baby, that we're outdoor people and we're going to go camping.
And that we're all going to sleep in the same small little space with a dog and a baby. The main downfall of this plan is that the last time I took my dog hiking, I let him run through all the tall grass. He was chasing all the bugs. And he, despite being small, loved the hike.
Uh-oh. Is there like a part B to this?
I was thinking, look how happy he is. And then an hour later, I was thinking, why is he covered in all these tiny little black dots that are moving?
Oh, God, I'm just ready to vomit in my mouth.
And then I had to sit with tweezers and remove over 50 ticks from his tiny little body.
I feel like this is an important lesson about hiking, but we're going to try car camping anyways, because the good news is most people are not removing 50 ticks from their children after a hike.
But every summer, we see families worried about tick bites, giant mosquito bites, bee stings, poison ivy, and all sorts of mysterious rashes. The tricky part is knowing what's normal and what's not, and when it's time to seek professional help.
Giant mosquitoes are not normal, but they are in Alaska. Do you remember how big those mosquitoes were?
They were the size of bears, honestly.
They were small bites, but giant mosquitoes. But here, I think you mean
big bites.
Big bites from little mosquitoes.
Yeah.
Well, welcome back to this week's episode of the Rolling Forward podcast. I'm Dr. Stephanie Rolin.
I'm Dr. Alicia Rolin.
I'm a forensic psychiatrist.
And I'm a pediatric emergency physician.
And this podcast, we decided to do this because as physicians, as sisters, we know that parents are constantly just inundated with health information. Some of it's accurate, a lot of it is confusing, and some of it's just misleading. And then you're kind of sorting through all this trash, trying to find the truth.
Our goal is to cut through the noise by bringing you practical, evidence-based information that helps you make informed decisions for your family without the fear, the hype, or the misinformation.
And this summer, we're doing something a little different. It's our summer school, our special summer series where we share lessons from the pediatric ER with one goal. We want to help your family enjoy everything summer has to offer while avoiding unnecessary trips to the emergency department.
Today's class is bugs, bites, and backyard adventures. We'll cover tick bites and Lyme disease, mosquito bites, skeeter syndromes, bee and wasp stings, poison ivy, and how to tell what's a normal part of summer and what deserves a call to your pediatrician's office.
So let's start with the bug that probably worries parents the most. It certainly worries me a lot. Ticks.
Ticks. Now I'm convinced that every freckle on my dog is a tick.
Ugh.
From now until forever.
Yeah, once you find one, then you just see them everywhere.
The good news is that while tick bites are common, most tick bites don't result in diseases like Lyme disease. And knowing what to do after you find a tick on your body can make a big difference.
So let's start with the basics. I'm a parent. My child goes to play outside. They come home, and there's a tick. Do I burn the house down?
The reality would be that you would scream and call me.
I would probably just send her to you. I'd be like, go see your Tati. Just like leave.
Put her in a bubble. Burn her house down.
No, but really. In this hypothetical situation, what should a parent do?
Ooh, in this hypothetical about to be real situation, car camping. The first step is simple. Remove the tick as soon as you notice it. Ugh. Send to me and I'll remove the tick as soon as you notice it.
Either you or another adult who is nearby should remove the tick as soon as you notice it.
The Center for Disease Control and Prevention recommends using a pair of fine-tipped tweezers. You grasp the tick as closely to the skin surface as possible and pull upwards with a slow and steady pressure. The goal is not to twist or jerk it because you don't want it to break off into different pieces or to leave the mouth part in the skin.
Mouth part is a word that I did not need to know.
Mouth parts?
Ugh.
With an S?
Worse.
Once the tick is out, wash the bite area and your hands with soap and water or rubbing alcohol.
I remember growing up, there was all kinds of things people wanted to do, like burn the tick with a match, which how do you do that without burning the skin? Honestly, I don't know. Or just put lots of like petroleum jelly or Aquaphor on it or nail polish.
Those are all things that the CDC specifically recommends not doing. They don't help remove the tick, and they actually might increase the chance that the tick releases more saliva into the bite before it lets go. Tweezers are really the safest and most effective method.
So once the tick is removed, do I need to run to the emergency department?
And chop off their arm?
I mean, these are the only choices.
Essentially never. Most tick bites can be managed at home. And in fact, most tick bites never lead to Lyme diseases or other diseases. Not every tick carries the bacteria that causes Lyme disease. And even when an infected tick is involved, the risk of transmission depends on how long it's been attached. In general, the bacteria that causes Lyme disease isn't transmitted immediately. The risk increases when the tick has been attached for 36 to 48 hours or longer, and it looks engorged. And you can look up photos on the internet and have nightmares forever.
I'm just going to call you. I'm not going to look that up. It sounds like finding a tick doesn't automatically mean that you need antibiotics.
Exactly. For most children, antibiotics are actually not recommended after a simple tick bite. There are very few specific situations where a single preventative dose of doxycycline may be appropriate, such as a high-risk bite in an area where Lyme disease is common, but that's something to discuss with your pediatrician or another healthcare professional if you've noticed a tick bite.
So let's say that there's a tick bite, the tick's removed, you speak to your pediatrician, antibiotics aren't recommended. Should parents watch for anything over the next few weeks?
The biggest concern with tick bites is Lyme disease, and the classic symptom is an expanding rash called erythema migrans. Despite the pictures that people see online, it doesn't always look like a perfect bullseye. It usually starts several days after the bite, and it gradually gets larger. Parents should also watch for fever, fatigue, headaches, muscle aches, facial weakness, and swelling in a large joint, typically a knee. And if these symptoms develop after a tick bite, it's time to call your pediatrician.
So I just don't want anything to do with ticks, ever. Is there a way to just avoid any of this in the first place?
Prevention is key. You don't have to avoid hiking or spending time in wooded grassy areas, but if you're in spaces where ticks live, you can use an EPA-registered insect repellent, wear long sleeves and long pants when practical, and consider clothing that's been treated with permethrin. And when you come inside or right before you come inside, do a quick tick check on yourself, your kids, and your pets. Showering soon after outdoor activities can help wash away ticks before they have a chance to attach.
Adding permethrin to my online cart right now?
The goal isn't to avoid being outside, it's to enjoy the outdoors while making tick checks part of your routine, just like putting in sunscreen. You put on sunscreen before you go out, you check for ticks before you go in.
All right, so moving on from the bug that scares parents the most to the bug that simply annoys everyone the most. Mosquitoes. Why do mosquitoes love kids so much, particularly my child's?
The truth is that mosquitoes are attracted to things like body heat, carbon dioxide, and certain chemicals on our skin. And children certainly get bitten a lot, especially because they're outside a lot playing in the summer, probably more than adults. And while most mosquito bites are just itchy and annoying, some children have much bigger reactions.
I remember I got a mosquito bite on your face, and it made one of your eyes swell so much. You looked terrible.
Thank you.
Yes, you did. It was terrible.
That's actually a great example. Children can have what's called a large local reaction, sometimes referred to as Skeeter syndrome. It's an allergic reaction to the protein in the mosquito's saliva. And the bite can very quickly become swollen, red, warm, and super, super itchy. It can look incredibly dramatic, especially if it's on the face. But that doesn't mean that it's infected.
So how can parents tell the difference between a big allergic reaction to a disgusting, annoying mosquito bite versus a bacterial skin infection, something like a cellulitis?
That's a great question because they can look very similar. A large local reaction usually develops within hours of the bite. It's usually very itchy, and the swelling may continue to increase over the first day or two before it gradually improves. A bacterial skin infection, on the other hand, it tends to become progressively more painful rather than itchy. The redness continues to spread, the skin may become tender, and children may develop fever or drainage and pus from the area. If you're ever unsure, it's always reasonable to check with your pediatrician.
So what should parents do for a typical mosquito bite or even one of these bigger reactions?
I'm itching my whole body.
I know this episode is making me itch.
Ugh.
Are we all so itchy? Are you itchy listening to this?
So itchy.
And now you're making me itch.
The goal is to control the itching and the swelling. A cool compress can help. For children with bothersome itching, a low-potency topical corticosteroid, like the over-the-counter hydrocortisone cream that you can find at any local pharmacy, might provide some relief. An oral antihistamine like Zyrtec can be helpful for itching, and if it's keeping your child awake, consider using Benadryl.
Which can treat the itch and make people sleepy. Perfect.
Win-win. And as hard as it is, try to keep kids from scratching. Scratching breaks the skin and increases the risk of developing a bacterial infection.
All right, so now my favorite question. Let's just go back to prevention, and I want to keep mosquitoes from existing in the first place, or biting me, at least.
I think that's particularly important. We live in an area where there is West Nile virus.
I'm so itchy still.
I'm like, sorry, Dr. Fauci, who canceled his grand rounds at my hospital because he was actively sick with West Nile virus. The CDC and American Academy of Pediatrics recommends using an EPA-registered insect repellent when you're spending time outdoors where mosquitoes are active. Products containing DEET or picaridin are both safe and effective while used according to the label. For children, insect repellent should be applied by an adult, avoiding the hands, eyes, and mouth, and it shouldn't be used on infants younger than 2 months. Long sleeves and pants can also be helpful when practical, and one of the easiest things that families can do around the house is eliminate standing water. Things like buckets, flower pots, bird baths, kiddie pools, tires can become mosquito breeding sites.
More words that I did not need to hear. But it sounds like overall, these giant mosquito bites, whether from a giant mosquito or a giant bite, can look alarming, but it's not automatically an infection. It's not automatically an emergency.
Exactly. Most mosquito bites are more uncomfortable than dangerous. The biggest challenge is knowing when it's simply an exaggerated allergic reaction and when it's something that could deserve a closer look by your pediatrician.
So now we're moving. This is like a tale of horrors here. We're moving from mosquitoes to another summer classic, bee and wasp stings. And I don't know about you, but I'm always thinking, is this normal or is my child allergic?
That's actually one of the most common questions I hear. The reassuring news is that most bee and wasp stings can cause a normal local reaction. It hurts right away, and then it looks red and swollen and it's tender, and the swelling might even increase for the first 24 to 48 hours before it starts to improve.
So, speaking as someone who navigated this last week with one of the children in our home, a swollen hand after a sting doesn't automatically mean that something is wrong?
It does not mean that something is wrong. It means that they were stung by a bee. A large local reaction can look dramatic, especially if the sting is on the fingers, foot, or face, but that doesn't necessarily mean that your child has a severe allergy. Similar to the other bug bites, the first step is to wash the area with soap or water, apply ice or cold pack to help with pain and swelling, and you can use age-appropriate medications if needed, things like NSAIDs, Advil, Motrin, things like antihistamines, Benadryl, and Zyrtec. If your child is stung by a honeybee and you can see the stinger, you want to remove it as soon as possible. How you remove it doesn't really matter. You just want to take it out of the body so it stops releasing venom.
So some kids are allergic, and when should parents start worrying about that?
The concerns about allergy is something called anaphylaxis. Anaphylaxis are when symptoms extend beyond the sting itself. You should call 911 immediately if a child develops difficulty breathing, wheezing, swelling of the lips, tongue, or throat, repeated vomiting, dizziness, fainting, along with widespread hives along the body. These are all signs of a severe allergic reaction that require immediate treatment with an EpiPen.
And so that's different than having a swollen finger or a swollen arm.
Exactly. It's a whole body involvement. It typically involves multiple systems. So your skin, your GI tract, your respiratory system, your heart. And so it's a full body reaction.
So it sounds like the good news is that these severe allergic reactions are uncommon and most kids can recover with simple supportive care. But now let's finish with one of the itchiest parts of summer as people who are about to go car camping. If we haven't talked ourselves out of it yet. And that is poison ivy. I feel like every family has a poison ivy story.
Absolutely every summer, we see kids who have somehow managed to find one patch of poison ivy on the entire hiking trail and decided to use that as toilet paper and also rub it all over their body.
Oh, I mean, the memories. I don't know who did that. I think one of the biggest misconceptions about poison ivy is that it spreads because you scratch it.
The rash itself isn't what's contagious, and so scratching doesn't spread it. Poison ivy is caused by an oily resin called urushiol that's found on poison ivy, poison oak, and poison sumac plants. Once the oil is washed off your skin, you can't spread the rash to someone else. But what can happen, though, is that the oil stays on your clothing, your shoes, your backpack, your gardening tools, or even your pet's fur. And if someone touches the oil later, they can develop their own rash.
So if your child is coming from the woods or perhaps your backyard and you think that they have touched or brushed against poison ivy, what should you do?
You want to wash the exposed skin with soap and water as soon as possible. It's also super important to wash clothing, shoes, any gear that might have come in contact with the plant. And your dog, if it's been running through the woods, might need a bath too.
Oh, it's a family horror story.
Removing the oil early may reduce how much of a reaction develops.
But what if the rash does appear?
Most cases can be treated at home. Cool compresses can help with itching, and over-the-counter topical corticosteroids may be helpful for mild localized reactions. Try to keep kids from scratching too much because scratching breaks the skin and increases the risk of a bacterial infection. For more extensive rashes, especially those involving the face, eyes, or genitals, or if the itching is severe, that's usually when it's time to call your pediatrician. Some children might need prescription medications, including oral steroids.
So to wrap up, it sounds like we should go car camping. We should not avoid the outdoors, but we should be aware of what poison ivy looks like. We should wash up after any possible exposure and then realize that most cases can be managed at home.
Exactly. We want kids outside exploring, hiking, camping, and playing. But a little preparation goes a long way towards making sure these adventures end with great memories and not a week of itching.
So before we wrap up, what is the biggest takeaway from today's lesson?
I'd leave parents with 3 things. First, prevention goes a long way. Whether it's an EPA-registered insect repellent, checking for ticks after a hike, or learning to recognize poison ivy, poison oak, poison sumac, a few simple habits can prevent a lot of summer misery.
Noted.
Second, most bites, stings, and rashes are more uncomfortable than dangerous. They can look dramatic, but they're often a normal part of spending time outdoors.
Check.
And finally, know the warning signs. Difficulty breathing after a sting, expanding rash or fever after a tick bite, poison ivy rash involving the eyes or face are all good reasons to call your pediatrician.
So let's plan not to keep kids inside. Let's get outside. Let's explore, hike, catch bugs, maybe even car camp, make some memories. But let's do it feeling a little bit more confident that we know what we're handling when everyone's just got a few extra bug bites coming home.
And that's our episode for today.
Rolling forward, Dr. Sister Science Facts.
Thank you for joining us for another episode of the Rolling Forward podcast on our summer school series.
And if you enjoyed today's episode, or it just made you itch, we'd love it if you subscribed. We usually don't talk about bugs. It's usually not an itchy podcast. You can leave us a 5-star review and then share it with someone else in your life.
You can find us on social media. Send us an email at rollinforwardshow. That's ROLIN_show@gmail.com.
And then we'll see you next week for another lesson from the Pediatric Emergency Department.
Until then, stay safe, itch-free, and enjoy the summer.
Rolling forward, Dr. Sister Science Facts.
You got a growly dog.
She doesn't like ticks either.
No one likes them. No, I mean, I know. I keep saying tick and then you keep growling. You're not wrong.